ever wanted something so badly from the time you were a child that you spent years chasing it, maybe decades? It could be a dream job or a role that you cherished or a future that you so clearly imagined for yourself. And finally, when you reached it, did life ask you to let it go? Today, I'd like to introduce you to somebody who knows this journey intimately. At the age of 3, when most of his contemporaries were learning to tie their shoelaces, he, wielding his toy stethoscope and his grandmother's hairpin for an injection, set out to become a surgeon. 4 decades later, at the pinnacle of his surgical career, after a prolonged and painful journey marked by not one, but 3 kidney transplants, he was asked to surrender the scalpel that came to define him. Welcome to the Luminary Lounge podcast, Insights from Lives Well Lived. I'm your host, Dr. Gayatri Sasikumar, and joining me today are Dr. Nagesh Simha, ex-surgeon and one of the founders of Karunasheya and the medical director of Karunasheya, and his equal partner in life, Dr. Jayashree Simha. She was the one who established the Department of Anesthesia at Manipal Hospital, Old Airport Road, and she was the ex-HOD there, and she's also my mentor. So welcome Dr. Simha and Dr. Jayashree to the Luminary Lounge podcast.
It's our pleasure. Thank you for having us.
So what I love about your journey is that it is a story of losses and renewals, second chances, and finding meaning in places that you never thought to look for. So Dr. Simha, I'm so glad that I get the chance to talk to both of you in a non-sitting room atmosphere, and this is in Karunasheya, and thank you so much for giving us the opportunity to be here in Karunasheya. So Dr. Simha, you were only, like I said, you were only 3 years old when you decided that you want to become a surgeon. Did you have a mentor or a role model that made you decide at that early an age?
I actually don't remember. The only thing that I kind of know that at the age of 3 I wanted to be a surgeon is because this was a story that was told to me by my mother, that I used to poke my grandmother with my mother's hairpin. In those days it was metal, and I used to poke my grandmother and keep saying injection. My favorite toy was a stethoscope, which was gifted to me by our family doctor, who in a way was my role model as a kid. And why particularly surgeon, I really don't know. But I was very, very clear that I not only wanted to be a doctor, but I wanted to be a surgeon. And I'm very grateful to the universe that it made it possible for me to reach that stage and to work as a surgeon for a fairly long time, till the universe, as I say, had a different role for me or a different plan for me. Yeah. Absolutely.
So I always feel when a lot of people now talk about delayed gratification, and I feel if there's any profession that epitomizes delayed gratification, that would be ours, because we spend years studying, burning the midnight oil. And then I feel 35 plus is when life as a doctor actually begins. But in your case, that was when you first got to know the diagnosis of your chronic renal failure. Was that around that time?
A little later, I was in my early 40s. It was, I did, I got some dipsticks to check urine, right? So for a lark, I just went and checked my urine, and I found that I had albuminuria. So I kind of knew that, the fuse was lit, probably a long fuse, but that was the time when I came to know. And that was in very early 40s.
So how did you take that news? Because you knew as a doctor that that's not a really good sign.
Like most of us do, a stage of denial, it's a long time that it's there. So, we'll cross the bridge when it comes.
So did you go and share this news with Madam?
I really don't know. Maybe you should ask her whether I really told her about my proteinuria.
When do you remember, ma'am? Did he come back and tell you that he did this test and it was positive? And
yeah, it was the time when new Manipal has started on the airport road, and we were all young, enthusiastic HODs and the so-called seniors at that particular point of time, and we were all kind of just to check the labs and lab standards. We were all doing our tests, so that's when we came to know about his proteinuria. Well, proteinuria, it's a early indication. So then we were thinking that, there is enough time to really do what we could do, what best we could do during that time.
so was there any aspect of illness that the medical textbooks never prepared you for?
I think no medical textbook can prepare anybody, a doctor particularly, to understand the full, what really an illness means. And you find a lot of statistics that are thrown in, and statistics are good just for having a discussion. But when it applies to a particular individual, maybe there's only 1% chance, and you may be that 1%. Or you may say that 99.9% of people do well, and you may not be in that 99.9%. So medical textbooks are fine. And the other thing is that medical textbooks give you all the possible complications. So generally speaking, doctors do make pretty bad patients because they tend to imagine everything. I don't know whether I really did that, but it's for others, like my people who looked after me, like Sudarshan Ballal or Shiv Shankar or others. They should actually probably give an opinion.
Yes, I think I should be interviewing them about you, maybe a follow-up on that. I know being we both are anesthetists, so we kind of know that surgeons are somebody who always have this thing that we are under control, right? We are always under control. So how did you feel when you had to surrender yourself to somebody else's care?
I think, yes, I do agree with you that that's the general tendency for surgeons. They think that they are under control of everything. They tend to be aggressive, and they want to get things done immediately. But in my case, I did realize that if I want to benefit from the care that I'm getting, then I have to surrender completely. At a very young age, a lot of people used to come and meet my father for advice. And he would always tell them that if you want me to give you advice, I want you to lay all the cards on the table and then leave it to me to decide what advice I should give. But if you tell me only 99% of the truth and hold on to it, then you may not benefit from my advice. So I did realize that. And again, in a lighter vein, okay, Jayashree and I, we got married pretty young. I was just 25 and a few months, and she was just 24. And then we got married, and then we went to Goa for a honeymoon. And in Goa, the lecture that I got was on Nishkama Karma.
I know this. Yes.
Okay. So then I told her, I said, you know what? Well, this is the honeymoon. Unless there is karma, there will be no karma. Right? But to be honest with you, and to give credit to her, all credit to her, is that whatever you do, you have to do it with full faith. And this is something that I, again at a very young age, I read about psychoneuroimmunology. And I did realize the importance of the mind in terms of immunity and how things benefit. And I've seen so many times that when people go to a doctor, ultimately decide and then go with full faith that, yes, whatever happens, I know that you're taking good care of me. I have a feeling that that person gets better results than if you were very suspicious.
Yeah. Yes, I totally agree with you. I think that's a very important point that you brought forward about psychoneuroimmunology of disease, where we always see that people who are positive, they always have better outcomes. So, and I've heard a lot from people about the way you handled your disease with humor. Did you all did you always find humor when you had problems, or was that a planned path
No,
that you
no,
wanted to
you
take?
can't, you can't plan humor, you can't fake humor. It has to be there. And perhaps I'm blessed with the fact that I can be, or I find humor in everything that, that happens around. My humor was honestly not very much appreciated by my doctors, only because of the fact that the first transplant failed, and the people who looked after me, they kind of blamed themselves for it because Jayashree was the donor, and they uh, were feeling miserable. And so I think my humor was a little inappropriate for them, at least. But then I carried on. I couldn't I couldn't help.
So you just said that your first transplant, the donor was ma'am, and you know whenever I talk to you both, I always it reminds me of the Christian wedding vows when they say in sickness and good health. So when you decided to donate your kidney to Sir, was there any moment of doubt? Uh,
Honestly, no. The reason is because I was a part of the transplant team at that particular point of time in Manipal Hospital. I was leading the team, and the very first cadaver transplant in Karnataka, I handled the cadaver. So it went on from that time. So I was very much of a part of the transplant team, and I used to counsel all the donors to feel comfortable, and this is going to be see, God has given us a lot of extra organs. I mean, I would say, like, though 10% is required, 90% extra is given only because in time of need you can use it. So that kind of thing. So I was always believed in that. So I said, when an opportunity came, I mean, not that I was hoping for it or anything, but when that opportunity came, I thought I should be the first one to do it. If I can't do it for somebody whom I care for, there is no reason I can tell somebody else to do it. So, and first thing was, of course, the match. When we found the match was good, I thought there was no reason to back up.
In one of the interviews, you actually call it your wife's gift to you. And sadly, that gift had to be, like in your words, discarded into the dustbin. I mean, not literally so, but
It went to the dustbin via the pathology department.
Yes. um, did you feel disappointed at any point? Did you feel,
Yeah, I mean, in the sense that, of course, if the transplant fails, then naturally, you do feel bad. And it was sad. I mean, she was in the room next door, and she came to know that, it hadn't worked. And so she wanted to talk to me, so she had to come and meet me in a wheelchair because she was not able to walk. In those days, they were doing open donor nephrectomies. Right? And then, I asked her, I said, you know what? It's great, wife giving a kidney to the husband, but it did not work. Okay, so where is the justice? I mean, I asked her that because I know poor girl, she has lost a kidney. So she gave me a answer which even today I kind of find totally different. She said, there's a very strong history of malignancy in their family, sisters and, grandparents and so on and so forth. So she said, how do you know that kidney might have been destined to become malignant? And therefore it had to come out of me, but it should not be inside you. That was her explanation. I gave up. I said, I'm not going to argue.
knowing ma'am, I think only she can come up with something like this. And I also know that you were the anesthetist when that kidney was removed.
Yes.
And you gave anesthesia for all his subsequent surgeries. And what was it like to No, I wouldn't say, like, what did it feel? How was your mental state when you were the anesthetizing your loved one?
Mm, well, let me tell you how I got into doing that. First of all, Dr. Iyer was very attaching. They were very close friends. So he used
Dr.
to
Iyer was one of the senior anesthetists in the
senior
department.
anesthetist who was my colleague. And initially he used to come forward to do that. But then at the end of it, he could not handle the problems that were encountered. So I used to say, okay, fine, it's all right. I used to be always the next person to be there. I said, why not? This particular thing, I think the credit goes to my mentor, Dr. S.S. Mehta, who was in Bombay, my teacher, and he was the head of the department of OTP. So it strangely between my theory and practicals of MD anesthesia, my father had a cervical spine injury, and he had almost quadriplegic and initially quadriplegic, and then he became quadriplegic, and then he regained some bit of thing, but some fine movements did not come later on. During that time, he had a severe diabetics became worse because of steroids, and then he had to be operated for prostatectomy. So we could not take out the because of the enlarged prostate. So that's when I was posted in the urology theater, and he told me, what you're going to plan for this patient. I told my father's condition. It was very complicated case as such because of the diabetes which was going this way, that way, steroids, cervical spine injury, and then prostatectomy, all put together. Those days, prostatectomy was not that simple those days. And he has a fairly large gland. So I just said, as I was exam going, I just rattled out, this is way I take care. Kar, so if you are doing it, do it for your father. Who else can take care of your father better than you? You will be the most vigilant person in it. So that gave me confidence. He said, I'll be there with you, but you do it. And after that, I had no hindrance. I had no second thoughts about doing cases of my own relatives, my mother, then my husband, then of course children, this one, that one. Nothing disturbed me. The moment they are on the table, it's my patient. That's it.
I think we are all blessed to have mentors like that who really encourage us to show the right path. And so truly said that it is your father. If it is not for you, who else is going to take care of him as much as you would? That's really lovely. And Dr. Simha, I want to ask you, so the first transplant ended up in a failure. Then you had a second transplant. You had a lot of complications after that. And then subsequently, you ended up getting a third transplant. During this entire journey, I want to talk about your faith in the system and in the doctors that were treating you. Did you ever look at them and ask, do they even know what they're doing? Did you go through any phase like that?
No, they did.
Okay.
They did, not I.
Yeah.
And for the simple reason, I knew the standard of their work.
Absolutely.
Because I, after all, was a surgeon in Manipal Hospital.
Yes.
I've seen them operate, and Jayashree has been part of the anesthesia team for years. In fact, the second transplant had a leak, and they had to open me 3 times in 7 days. And so before the third time, there was this possibility that it might bleed. They might have to remove that. So they called in another surgeon from outside just to be there, to give them moral support. And my nephrologist and very dear friend, very proper, told me, he says, Nagesh, if you would like to take another opinion, you want us to call somebody else, would you like to go to some other hospital? So I stopped. I said, hold on. I said, don't try and wash your hands off me. And I also said, please don't use such unparliamentary words with me. Second opinion, go to some other hospital. Whatever happens to me, happens to me here. I think that probably gave them a lot of confidence.
Confidence.
My humor was becoming worse and worse, and it was causing a lot of distress to a couple of people.
Do you want to share the Al-Sur Lake story with our
Of
listeners?
course, I must. So the third transplant, we were discussing about it, and my nephrologist said, Nagesh, you can, I somehow feel that third transplant will work. But if you want to, you can go on dialysis, for the rest of your life. So I said, look, my friend, I've got accustomed to the comfort of a transplant. And if you insist that I should be on dialysis, I'd rather jump into the Al-Sur Lake. So he looked at me. Obviously, he knew that I was, again, my sometimes stupid humor. He said, Nagesh, there's no use because there's not enough water for you to drown. And it is so damn infected, all that you will get is diarrhea. And we laughed. And I thought that was the end of the story. I walk out of his chambers, and the transplant nurse, whom I've known as a student nurse also, she comes running and holds my hand and is almost in tears. He says, sir, I hope you're not serious about it. I said, my dear, for heaven's sake, So I've always, I'd go crazy if if you tell people, you stop your humor. It's terrible for me.
I'm listening to you, and keeping the humor apart, I feel your doctors were blessed to have a patient who had so much of faith in them.
Possibly.
Right? It's not very often we come across somebody who blindly, like you said, surrenders.
Yes.
And I remember ma'am was telling about her childhood bharanyasa that she did, where they surrender oneself to the Almighty, right? So in a way, you did. Can I call it bharanyasa to his doctors, and you surrendered yourself to your doctors and had full
but they
faith
deserved
in them?
it.
Yes.
They were
Absolutely.
not undeserving.
I work with them, and I know the kind of standards of care they have. So, yes, absolutely true. From my personal experience, I've always, I think, and also seen people who go through bad times. We may say a lot of things, when we're outside, when talking to people, we're strong, we keep a strong front because we don't want people around us to be, feeling low because we are feeling low. But when you're alone, right, in your room, in your hospital room, were there times when you questioned, why me? And did you ever look up and get angry at God, or did you find yourself going into the spiritual
To be honest
path?
with you, never. I don't think either she or I, some of my friends were very upset. They'd come and sit in my room, and there's one particular friend of mine, sadly no more. He just looked at me and says, hey, doc, are your doctor friends experimenting with you? He was genuinely upset about it. I never had that feeling of why me. And when the first transplant failed, and of course Jayashree donated, our mentor, Dr. R. Martanda Verma, the very famous neurosurgeon, he came and met her, and then he came and met me. And then he told me, he said, son, I want you to remember one thing, that whatever comes out of chaos is of a much higher value, or much higher quality. And he says that's the law of nature.
That's so absolutely. That's such a wonderful.
And that's what happened to me in my life. If you see all the stuff that happened post my giving up surgical practice.
Yes, I think that's an amazing way to look at the negatives. Can I say negatives, or the bad times that we go through?
In a way,
Don't even call it a negative or a bad times. Call it as challenges.
Experiences or challenges. And I think when we go through experiences or challenges, we come out much stronger. And that's probably what that quote was about.
Yes. I mean, you may say bad times, and you never know how good it is.
Yes.
That can happen. I mean, even at the cost of taking a minute, there's the story of this minister who kept telling the king that anything happened is the best thing possible. So the one day the king goes on a hunt and he injures his thumb very badly, twanging the bow. And he's in severe pain. And he asks the minister, is this the best thing that can happen to me? So the minister said, yes. So the king gets totally pissed off with him, and puts him in jail. So they ask him, he said, yes, this is the best thing that can happen to me. A few months later, the king is going alone, with his minister not there. And they are accosted by a bunch of cannibals. And when they see this injured thumb, they do not sacrifice him because he's not a perfect human being.
Oh,
So they let him off.
okay.
He goes back and apologizes to the minister. The minister says, Your Majesty, if I was with you, they would have killed me.
So yeah, him going into jail was also a good
Yeah,
thing
it was good for
him.
him. So, and if nature has to make you change track, it has to throw at you something that you may feel is bad. Okay, I do not, like she said that, to say, something bad happened to me. Something happened to me that was different. Something happened to me that I did not expect to happen.
Yes.
But if you take it in your stride, are there disappointments? Yes. Are there times when you feel that I deserved something better? I should have been promoted before somebody else. But then you got to think of yourself and say, hey, you know what? There must be something better waiting for me. It's always, I have always taken that attitude, and so has she.
Yeah, I totally agree with you, because I went through something similar in my life where I really sat down and thought, I went through all this because I wasn't probably as, mature at that point to, not be able to surrender that way. But I used to get angry. I'm a very spiritual person. I'd like to believe I'm a very spiritual person, but then I used to get angry and I used to always ask, why me? But then having come out of it, I look back and feel that there were really good things that came out of that.
Yes.
So I totally, agree with what you say. And then while you're at it, I want to ask you, when your nephrologist, after your third transplant, you had a lot of complications after that as well. When he asked you, when he said, who broke the news to you? That,
She did.
Okay, all right. So that they felt it is better that you stop your surgical career.
It wasn't after the third transplant, it was between the second and third transplant.
Okay.
When he used to have, he was on high doses of steroids. He had a vascular necrosis of both the hips, and he had to undergo bilateral cord decompression followed by bilateral hip replacement. Those things went off well, all right, but a lot more challenges. And every time my surgery had to happen, again escalation of steroids, again escalation of immunosuppressants, and a lot of insult to the grafted kidney. And that's how after 5 years, the second transplant kidney failed. And that's when the third transplant, after third transplant, touch wood, he keeps bothering me about his ventral hernia. I said, you look pregnant, but it's okay, it's all right. But I'm not going to anesthetize you one more time, because it would involve a lot more complications, which would always interfere in the life. See, already he had every challenge comes like, it may not be the end of life, but it's a bend in life.
Yeah.
So that when we have to take it, how well you take it, well, you chose to take it gracefully. I said, it's okay. Little looks this way, that way, it's okay. Only have to look, it doesn't matter.
So
but what you can perform is important.
If I might butt in, I think what Gayatri has been saying is the decision that Balal took, that I should resign from the surgery department because he did not want me to continue my practice as a surgeon. That news was conveyed by her to me because my friend was not, he felt that, how would I take it? So if that's your question, how did I respond to that?
I'm waiting for that reply.
Yes. So I was actually absolutely delighted and excited.
Really?
Yes. And I'll give you the reason why. Okay. If you really look at my specialty and at that time of general surgery is a dead specialty now, unless you do something,
Yeah.
super specialized. Otherwise, at that time, general surgery was a waste paper basket. Whatever the others did not do, like an infectious sebaceous cyst or a ingrowing toenail or something like that. So I realized that there was nothing very exciting or something to look forward to professionally. That was one. The second thing was that I was kind of tired. I did not have the zing. And I thought to myself, I said, this is a good excuse to get out of it. Because if I had just decided one fine day I want to leave, then my colleagues would not have allowed me. Oh, no, you do this, we'll help you around that stuff. And more importantly, my work in palliative care had just about begun. So, and then I looked at it as a signal from the universe. Okay, that all right, you wanted to be a surgeon when you were 3 years old. Okay, so the universe says, okay, I give you the chance. You did whatever you did. Okay, and now you got things to do, which are different. And that again is you surrender to the signal that you get from the universe. And that doesn't make you unhappy then.
Yes. When you talk about the universe, and I've heard you talk about the universe in a couple of other interviews, one of my personal favorite quotes is by the author Paulo Coelho, who says, when you really want something, the universe conspires to get it for you.
Yes.
Right. So I also, secretly believe in what the universe can do if you really want. And I always say this to my daughter, if you really want to do something, everything will come in place for you to get it. So, Dr. Simha, I want to ask you another question. Again, I'm sorry, I'm sticking to the time of your illness because I feel there's a lot of learning during that phase. You've been on both sides of the stethoscope. What did that phase of life teach you what, normally you would probably not have, if I were to ask you that question?
Yes. So what happens is that at least my generation, and even now, of course, I don't think it has changed very much, is that as medical students or even as postgraduates, we believe that we are infallible, that if we did not, or the patient did not do well, or something happened, then it was a failure. And we were concentrating only on the medical aspects of it. Nobody bothered about how the person felt when you spoke to him or used words which, normally you might find as absolutely wonderful Oxford English. But looking at it from how the patient would feel, it would be absolutely atrocious. And I did go to Manchester to do an advanced course in communication skills. That was before all this tamasha started.
Communication skills in healthcare?
Breaking bad news, collusion, denial. I went to Manchester and worked with Peter Maguire, who at one time is. And so whenever I take, I've been teaching this for the last almost 30 years, and whenever I talk, I say BC and AC. BC means before Nagesh Simha learned communication skills, and AC is after Nagesh Simha learned communication skills. And I give them examples in the BC era of most inappropriate, insensitive, pathetic communication that I have done with my patients, but I did not think that it was wrong. And after that, I realized that, it was terrible. So that is something that I have learned. That it doesn't matter, you can be the greatest surgeon in the world, you can do things there. If you do not have compassion and if you do not have humility, then there's no hope in hell for you.
Compassion, humility, and then good communication skills.
Yeah, that is also important, yes.
Yes, because, just the other day, I think I should come and take a course from you with communication.
I'll
because
do the workshop.
I personally always feel that I communicate really well with my patients. Like we all doctors feel we're good at things. But recently I had to break, I wouldn't say bad news, as in a patient was not doing really well and I had to talk to the patient attenders. And I'm sitting and talking to them, and I know from their face that they're not getting what I'm trying to tell them. And then I tried again, and I tried 3 times. And then I could just know, I just sat there and felt completely defeated in a sense, because I knew that I had not, they were not getting what I was trying to tell them. So I think you rightly said that communication is a really, really important skill to have, and I feel we should have that part of our. I don't know if it's medical education, because that's too far behind for us to remember when we become clinicians, but at least maybe all postgraduate courses, we should have some kind of a communication program. Okay, so I'm now going to enter into your, what is that, AC era, right? So this is after you gave up surgery and full-time start concentrating on Karunasheya. And I really congratulate you at the wonderful campus that you have. I'm yet to see it. I'm hoping that after the interview, I get to go around and see.
Sure.
Would you like to tell us a little about Karunasheya and how it all started?
Right. So, first of all, again, I talk about the universe. And if the universe wants something to happen, as you rightly said, Paul Coelho's wonderful statement. So, I joined my Rotary Club, Bangalore Indiranagar, in 1983. I was a few months short of 30. And a few years later, a Rotarian friend of mine called me up and said that his senior and his senior's friend had started the Indian Cancer Society in Bangalore. And they wanted some suggestions. And so I asked my friend, why are you calling me? He said, no, yaar, you come and you'll something or the other you'll say and something will come out of it. And let's meet at Bangalore Club over a glass of beer. I said, wow, that's great. So I went and met both the gentlemen. I gave them some ideas. And then one of them, my very dear friend Kishore Rao, he had this whole thing in his mind about setting up a cancer hospice. And I'd keep meeting him and he'd keep talking to me about it. And I said, yes, yes, yes. Wonderful idea. One day I walk into a flight from Mumbai to Bangalore and he's sitting next to me. Not by chance. The universe wanted it. And the whole 1.5 hours he was talking to me about that. Anyway, fast forward, 3-4 years later, my very close friend became the president of my Rotary Club, Gurmeet Randhawa. And he kept telling me that our Rotary Club should take on a project which is big, permanent, and involving all the members. So I got the Cancer Society and my Rotary Club together. And, we agreed to collaborate. And that's how Karunasheya was thought of, And it's a long story. A lot of things happened. A lot of things fell into place. And, we were able to establish this, campus in 1999. The trust was in 94, home care in 95, and inpatient, the wards that you see here. And from then onwards, lots of things have happened. And to be honest with you, I think I have more fame, if at all, as a palliative care physician than I ever got as a surgeon.
I remember when I came to your house once, you talked about how you believe in na aham karta.
Yes.
And hari karta. So again, I think that was the universe playing a role in,
yes, you should not
getting you to probably where you really
not
were
only,
meant to be.
That's very true. The universe gets you there. But what is more important is that nobody should think that I did it.
Yeah.
For example, I don't want to brag. You go around Karunasheya, you'll find a number of stones inaugurated by Foundation Stone. I was the first chairman for 18 years. My colleague Kishore was the managing trustee. And now Gurmeet is the managing trustee. You do not find our names anywhere. Because na hum karta, I am not the doer. Yeah. Then that attachment goes away.
I belong to a family of Rotarians. My father was a root tractor. He became a Rotarian. I'm a Rotarian. My daughter was an interactor. And I feel really proud to see, and I know I was the president for a year of my Rotary Club, and I know how difficult it is to do projects that, you people decided that has to be there, which will go a long way, right? So it's really beautiful to see that Rotary with the Indian Cancer Society could come in and do such wonderful work. But again, drawing from the past, your vulnerable phase, do you think it when you came out of that, it changed the way you saw patients in Karnash?
Absolutely, absolutely. I'm happy that it happened because of the fact that if I were to continue with my old bad habits in the BC era, as I said, it would have been pathetic and terrible for palliative care. So it was very easy for me to learn. And many times when patients tell us something and we say that I can understand, I used to use the word I can understand, but for the last 2 or 3 years, I've stopped using it because nobody can understand. Okay, I might talk to a patient who's undergoing dialysis, but what is his pain? I'm not able to. So what I recommend to everybody is that you should say, I can imagine how you're feeling. Or if it's something so terrible, even if I tried very hard, I just cannot imagine. So two things happen. One is that you're correct, you're proper. And the second thing is that the person to whom you're talking will feel validated and will feel that this person has really, really understood the pain that I've gone through.
I know this is a totally different context, but I have a daughter. I have a teenager daughter, and teenagers, they go through a lot of things, emotional. When she's trying to tell me, initially I always used to say, I understand. And then, like you said, I now try to correct myself because I know when I was a teenager, my problems are completely different. When she's a teenager, her problems are completely different. So it would be totally wrong for me to say, I understand. And thank you for, telling me what words I can use with my patients as well as with my daughter, because I feel that's really important for us to be
Just
mindful
say,
of that.
I just cannot imagine. Then you're even better.
Then that'll be giving one upper hand to her, which
Doesn't matter.
as a parent, we find a little difficult, right? Egos don't allow that. Okay, so Dr. Simha, it was wonderful talking to you, but like it's a ritual in our podcast, I have a series of rapid fire questions for you, and I'm going to be reading them out to you.
You had warned me about it, I know.
Yes. So the first question is prefixed one, because you told me to ask you about why you like pineapple
Juice, right.
Yes.
So, when I was on dialysis, there are three fruits which are allowed.
Huh.
Apple, pineapple, and papaya.
Okay.
Low potassium. So I remember that once during my second transplant phase, I got overloaded and I needed emergency dialysis. They said stopped and they put in a central line. And so halfway through that, the guy in charge of ICU, our friend Jose Chaco, he said, would you like to drink something? I said, yes. Now, of the three, papaya juice is not very interesting. Okay. And apple is okay, but pineapple, I really imagined it. And I still remember that whenever I used to come to Karunasheya during my dialysis phase, pineapple used to always be kept in the fridge in Karunasheya. And one day I came unannounced, and within 22.5 nanoseconds, I saw my colleague Shekhar, who was our auto driver, charging outside. I said, where the hell is he gone? To buy pineapple. Because there was no pineapple there. And so I got that pineapple juice, a brick pack of 200 ml. I drank half of it and I said, no, I'm going to drink it later so that the pleasure of that juice in my mouth can linger a little longer.
Dr. Simha, when you're saying this, I want to say that we spoke a lot about spirituality, your faith, your surrender, and I think I didn't speak about the friendship that you've had and the friends you've had and the kind of support system they have been to you during your entire journey. And I think that ought to be saluted.
Yes,
Right?
it's absolutely amazing.
Yes.
9 of my friends donated blood to me. Their blood was given to me. They very wrongly claim that I'm a better person because of their blood. But,
Typical friends.
but I call them my blood relatives.
Okay. All right. Okay, the next one is one word that defined you before your illness and one word that defines you now.
I would say overconfident and probably bordering on arrogance, that I can do anything, I can get away with it
So this is before the illness?
before the illness.
Before the illness, okay.
And after going through all that, I think I'm much more sedate. Though relatively speaking, my friends don't think I'm a sedate guy, right? But as compared to what I was before, I think I'm mellowed down.
The kindest thing a healthcare provider did that they might not even remember.
When my first transplant failed and I knew that I was, it was not working, there was no place in the ICU. Regular bed was not there in the ICU, so they put me on a trolley. And there was this nurse, so terrible that I just can't remember her name. She stood next to my trolley whole night. I kept telling her, I said, you sit down, there's a stool there or a bench there. No.
They're those really absolutely amazing people that
Absolutely.
right? Yes. The most profound words a patient ever has said to you.
I remember there was not really the patient, but probably her husband. And there was this lady who had some sort of a lesion in the small bowel, and resect, anastomose, and after 5-6 days, the typical time for a dehiscence, it would open up. We tried the second time. I called 2 surgeons from outside to do that, and every time this happened, and finally the patient died. And I was, feeling so miserable for the husband, but the husband actually was consoling me, saying, I can see all that has happened and that you've done whatever is best possible. So I think
It's one of
that
the
is
most
something
profound things,
really, really special.
Yes. What do you miss most about surgery?
Things are a little better now because Jayashree is retired. So she doesn't come and tell me stories about what has happened in the OR, right?
Oh, okay. I can get it. Yeah. Did you have?
I do miss
In what modern? What do they call it? FOMO.
FOMO, fear of missing out.
Fear of missing out.
Yes. And, again, it's a little morbid, but in a lighter vein. I hadn't touched a knife. And one of our relatives had died. And he had a pacemaker which needed to be removed. And Jayashree brought a minor surgery set. So I said, I can't do any harm to this uncle. And I took the scalpel. I put an incision. I said, wow, I can still operate. I dissected out the pacemaker, and I sutured the skin. Beautiful, everted edges, equidistant sutures. And I said, not bad. I still can do it. I do miss. There are times when I remember some of the cases that I did, the difficult cases that I did or I assisted. But I always tell myself that was one time, and now it's something else.
Whenever I talked to the two of you, the fact that she brought that surgical instruments for you, she knew that it would be really special for you to be able to do that. And look, I don't I'm not in the sense that, cutting open that uncle, but.
No, we went to his house and the body was there. If I had not done it, she would have done it.
Honestly,
but then she lets you do it because.
Yeah. Honestly, I didn't think he was going to offer to do it. But then, I just thought I could help them out instead of taking, it's so painful to move at that particular point of time. The best that we can as doctors can do it at home.
The most overrated virtue in medicine.
Overrated?
Virtue in medicine.
In medicine. I would say that theoretical knowledge is overrated because it doesn't always work that way.
Yeah.
And I would also, sort of saying that I know everything, overconfidence.
Yeah. If you could whisper one thing to every medical student during their white coat ceremony, what would that be?
I would say, my dear friend, the theoretical stuff is all over. You are learning swimming without getting into the pool. You were standing outside and, your teacher used to
Learning to flail your hands.
demonstrate like this. You're actually going into the thing. And I would say that, knowledge is fine. You can get it now. We've got a lot of things, to be able to recall that. Skill is very important. But I would say that humility and compassion are two things that I would whisper.
Absolutely.
And you're not infallible.
Yes. So, humility, compassion, you're not infallible.
And be prepared for disappointment.
Yes. And you're now not going to jump into a swimming pool, but into a ocean with full tides.
Yes.
The last one, if these walls could speak, what would they say about your journey?
The walls would obviously say that, look, buddy, you went through it, but you're very lucky that you had a wife like Jayashree. In fact, sometimes, it happens so many times. A lot of my very close friends, suddenly they'll talk and say, hey, Doc, you're very lucky to have Jayashree as your wife. So
I feel so too.
That's all right. So I said, what do you want me to do? I want to write. No, but seriously, I've been very grateful to the universe. It has given me everything that I wanted or I need. Excellent wife, wonderful children. Eldest son is married, daughter-in-law.
Grandchild.
Grandson, of course, now. And all my relatives, I'm very close to her younger brother, particularly. Her niece, is like
Both the
Practically, yeah.
in fact, two of my
Another
nieces.
daughter.
Both the nieces.
Yes.
Yeah, they're very, very close. So I have no complaints.
So I have I have rapid fire questions only to you, but I feel we keep talking about how wonderful Madam is, and I think I'll have a rapid fire question, just one to Madam, because I think somebody ought to be talking something good about you as well, right? So, can you tell me one quality in him that you've always admired?
Well, if you have, I don't think you have seen our wedding photos.
No.
There is one particular thing in our weddings is to watch the Arundhati star. Because Arundhati and Vasishtha were supposed to be very, very close pair, and they was to do together everything. So let your life be led by that couple who have been very successful as a couple. So that is being shown. So in our time, it happened, we finished, our wedding was over, and in the middle of the noon, exactly 12 in the midday, he took us to show Arundhati star. What will you see? So he was showing in one direction, I was looking it in one direction, he was looking in one direction. So, and somebody has captured a photo of that.
Okay.
Those days it was only black and white photographs. So honestly, we have led life like that. In that sense, I never tread into his field. I'll never stop him from doing anything. Today, if I got one wish, if I got his, till he feels comfortable and fit to come to Karunasheya and do his whatever human service is doing to the society, let him continue doing. I will not come in his way. At the same time, I have a very much of a, things for divine outlook or a spiritual outlook. So he doesn't come in my way. We do meet occasionally, like, I said, okay, we have never twinned in our life, so let's twin, like wear blue. So, little pleasures in the life, we do it together, it's fun. I don't say because just we didn't do it then, we didn't have opportunities then, we didn't look it that way. Now you have all the time, we have nothing to stop us from doing it, and we agree upon that. There are the best time we have in the morning, coffee time. One of our guys will sit and listen to the old music and listen to that and have coffee. Sometimes we have got a beautiful house, we have got a beautiful balcony. We sit there and have coffee.
You can see the ISKCON temple from that balcony.
Yes. So from that way, we have been different yet together. And we have never come in tread in each other's way. I think that is the best way to, everybody gets what they want, If it's all these things, one thing, he was very generous, never jealous, never suspicious. These three qualities I have always felt, and there's no differentiation, he had to give for some reason, health reasons, he had to give up surgery and everything, and I used to get there, but that not a single day he had a feeling that, your money, my money, that kind of jealousy or those kinds of things he never has.
Yeah.
And I think that honor and that respect I always have for you.
I was just going to say that because that comes only with respect for your partner. True. Right? And every time I talk to you, I always...
I had to have respect for her.
Yeah.
For the
She was
simple reason,
anesthetizing you.
No, because my parents didn't bother about me in the sense, not that they neglected me, but she was everything.
Yeah.
To such an extent that my father literally dropped dead in her arms. Literally, just fell in her arms and died. And many times my father would say, I'll talk to her. And I was very happy for that. So, God has been kind.
Yes. And God has been kind to me that I got an opportunity to talk to the two of you. And thank you so much for opening your hearts to us. And, your journey, I think, is a lesson that when life shuts a door, it's not always the end of a story, but the beginning of an amazing new chapter. And personally for me, I kind of always look at it that life does not always follow our plans.
Yes.
Right? But sometimes, somehow, it gets you to the place where you are meant to be.
Exactly.
And I think both of your stories just teach us that. And today when we sit in Karunasheya, I think my whole team of, the camera people and my daughter who's also sitting in this room, I feel we're all blessed to be here. And I can't help but remember the quote that Dr. Martanda Verma said to you, that out of everything that comes out of chaos is of a higher order.
Superior order.
And a superior order. And, you're giving dignity in death to people, and I think it's beautiful. And thank you so much for sharing your time with us.
One more thing I wanted to say, he used to say always, this too shall pass.
Yes, I know.
That used to be the code word for him, Nothing is permanent, neither the pleasures or pressures. So if you take it with equanimity, I think life is done.
Yes, and I think that wasn't that the poem you had it up on the
yes.
So that yours.
So when I was very sick and I had this leak,
yes,
and tubes and lying in the hospital, I asked one of our colleagues, pathologist Sanjay Pai, to give me something to read. He suggested, and he gave me a copy of the book, Light from Many Lamps. Beautiful book. And in that there was this poem, This Too Shall Pass, which basically, says that, nothing is permanent. So I got that put on a paper and I stuck it outside my door in room 814 in Manipal Hospital. And I forced my surgeon to read it every time he came inside my room, because he was so upset with himself that things, were not going the way it should. And I still believe in that. This too shall pass.
Yes. So to our viewers, thank you very much for watching. And remember, no matter what challenges life brings your way, this too shall pass.
Yes.
Please support us by subscribing to our YouTube channel. And until we meet next time, stay healthy and stay safe. Thank you.